think that the challenges that health and wellbeing boards face often reach beyond their geographical boundaries, and actually the opportunity to come together around wider determinants of health, around public health, around the reconfiguration of services, really do need to cover sort of bigger populations. So the ability to come together, to be more able to actually address your own local population needs, I think will be an important part of them working more closely with each other.
Working across boards in East London is limited. We've had experience of working together around the Olympic host boroughs, what we now call the growth boroughs. And we've put together a strategy and a working plan on childhood obesity. This has engaged us at different levels, working on our land and planning strategy and also working around young people, trying to reduce the incidence of high-calorie drinks at school and things like that, reduce the amount of takeaway shops selling high-fat, high-calorie foods. That's the experience at the moment. It's tentative steps of working together around similar problems.
The Bournemouth and Poole Health and Wellbeing Board is one of the few examples where two unitary local authorities have joined together to form one board, and they have alternate chairs, so they have two chairs, one from each local authority that runs the business of the board. Their key finding is that they've focused on their jointly agreed priorities to meet local needs, so they're addressing the local needs that span across both areas.
I think what we've heard today is that where it's worked really well, an awful lot of effort has been put in between meetings in order to establish trust and build relationships. And I think it's agreeing in the very first instance what it is you're trying to achieve and why it is you think that's something that can be better delivered across a number of areas rather than just one. And I think if you've got that and you put the work in, then you stand a fighting chance of making a real success of it.
For me, the biggest lesson that I've learned from working across the 6 health and wellbeing boards that we have is the power of relationships and the importance of building trusting relationships with the senior leaders that are on those boards. And that's not just for the individuals who attend those meetings, but actually the whole of the senior team and the senior leaders within the local area.
I think the biggest lesson that we've learned in terms of bringing health and wellbeing boards together in Greater Manchester is that actually it's much wider than the health and wellbeing boards being brought together. It's about looking at health and wellbeing in the social and economic context of the Greater Manchester region and the role that health and wellbeing plays in developing that economic strategy that will improve health, improve wealth and economic regeneration in that area, because health and economic benefit are clearly related. One of the things that they've done is bring the local integration plans from each of the 10 boards into a central point where we can look across Greater Manchester. That allows us to benefit from the experience of others and look to see how integration across the whole of the conurbation can take place. That's actually saved £250 million already, but we have £1 billion to save. But it's a great start.
I think the most important thing for health and wellbeing boards to think about is just that principle of no surprises, being able to have a really early conversation and trusting each other enough to know that actually the initial idea might not be what we end up with, but it's what we're going to start with and how we're going to have that conversation that makes a difference.
I think it's really important they've got a sense of common purpose, what it is that they want to do together and what they want to achieve together. Once they've done that, I suggest they just get on with it, because I think the lessons we've learned today is you learn more by working together than working out how you work together.